Today we're going to talk about today about population health. So before we get started, I wanted to kind of go over a few test taking strategies that I find they're very helpful. So we're going to do that before we get started, before we go into the main subject for today. And I wanted you guys to be aware of a few strategies that you can use in your exams. Number one, focus on the data that's on the case study. Again, read every word. Make a decision about what the question is asking. Okay. Note the subject and determine what content is being tested on that question. And of course, number three, visualize the event and recognize cues. And you can try to see if there's any abnormality in the data that you're being given. Very important for next gen questions. This is where this is going to become very important. Okay, so number four, determine who the client in the question is. Again, is it a male? Is it a female? Okay, these are the things. Remember that you're going to have different things depending on the age of the question, the sex, of the client, the age of that client. Some diseases are going to present in the pediatric population. Some other diseases are going to be present on older people, okay? Some are going to be specific for teenagers. So you definitely need to be aware of what is being asked and who the client in the question is. Number five, look for strategic words. Strategic words make a difference regarding what the question is being asked. Again, there's going to be a lot of information in this slide. So, as long as you are exposed to this information at least once, you should be able to answer any questions that you were given without a problem. Number six, determine whether the question presents as a positive or a negative event query. Okay. For NCLEX items, especially for the multiple choice, or multiple choice responses where you need to select more than one, avoid asking yourself, what if, okay? This is going to lead you to an area where you do not want to go, and you're going to start reading into the question. To answer these questions, make sure that you know the information that's being asked, and don't ask, well, what if, okay? In NCLEX questions, remember, when you are given information, unless they actually specify it in the stem of the question, is going to be a perfect world kind of scenario. So you are going to have everything you need to treat that client, okay? So unless they say it, you have everything you need, all right? So stop asking yourself, what if? Because I've seen many people, they start asking, well, what if this or that? And, they change the questions and then they get it wrong. For next gen questions, you might have to ask yourself, what if? And this is the exception of that rule, because you might need to think about all the existing and potential concerns, possible complications of, especially for pharmacology, that you might need to consider. So this might be the exception to that rule, okay? So if it's not a next gen question, stop asking yourself, what if, okay? Again, make sure that you apply the clinical judgment and measuring model. We're going to talk about it in a few minutes here, along with other test taking strategies. Okay, and always use the process of elimination. Okay, I don't need to tell you guys this, but I have to mention it, right, for completeness sake. Always read each option carefully. Once you have eliminated options, reread the question before selecting your final choice or choices, okay? In multiple choice questions, make sure that you look for comparable or alike options and make sure that you eliminate them, okay? This is a strategy that you can use for your exam. If they are comparable or alike, eliminate them, okay? Also look for the umbrella option. This could be very helpful. If you could locate the umbrella option, meaning And I think we have an example of that later on if there is a option that kind of takes all the other options under its wing, or that could cover all the other options. That's probably going to be the correct options. And any closed-ended words, any closed-ended questions, things that end on yes or no, or very very common in questions where you are trying to get information from your client. Avoid closed-ended words and closed-ended questions. Questions that the answer is going to be yes or no. That's probably going to be incorrect. Okay, so if you can identify it, make sure that you eliminate it. All right. Some other strategies: ABCs, air, breathing, air circulation, Maslow's hierarchy of needs. All right, very important. We're going to go over Maslow's in a few slides here, but your airway, breathing, and circulation. Remember, airway is always first, breathing is second, and then your circulation. Okay. Steps of the nursing process, very important. And we talked about the CJMM. All right, but we're going to go over in a few slides. For questions that require you to have some knowledge about cardiopulmonary resuscitation, make sure that you use CAP, compressions, airway, and breathing. CAB, right? Make sure that you always use in that order. Therapeutic communication techniques to answer any questions, right? That when you need to, there's a need for you to get information from your client, make sure that you focus on your client's thoughts, feelings, concerns, anxieties, and fears. Remember, what you think or what you are feeling or what you think is right is not what's important here. All right, it's all about your client. You're going to be an advocate for your client. All right. Delegating and assignment making guidelines, make sure to use them. And we use that to match the client needs with the scope of practice of the healthcare provider. Pharmacology guidelines, all right, make sure that you use them. And we're going to go over a few things in a few slides here. But whenever you see a pharmacology questions, there's always going to be pharmacology guidelines. So make sure that you follow them. And we're going to go over a few in a few slides. This is going to be a lot of information, and I know that, so I just wanted you guys to kind of have an idea of what you might see on the test. Again, you only probably need to say this once, and you're going to be getting a lot of information, all right? So what do we mean when we talk about strategic words? Strategic words are words that are going to point you into do I need more information? Do I need to do an assessment? Do I need to prioritize? Okay. So whenever you identify those words, it points you into the right direction. So whenever you see words like best, early or late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, priority or primary, the question is telling you that there is a need to prioritize. Okay. Whenever you see words like ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, and recognize cues, then the question is probably directing you in the fact that you need to do an assessment. Okay. Some other strategic words that you might see are the need for further teaching, further education, or the need for follow-up. Mostly you're going to see these words whenever they're trying to ask you for a positive or a negative event query, okay? So very important that you keep that in mind. Again, whenever you read a question, make sure that you identify the event in that question. Make sure that you identify the event query and all the options, okay? So this is how a NCLEX question usually looks like. In this case, for example, the event is going to be the nurse is caring for a client with terminal cancer. The event query is the nurse would consider which factor when planning pain relief. This part of the question is pretty much what they're asking you about. This is what they want to know, if you know, okay? And then you're going to have your options. Some people like to read them in order, 1 through 4. Some people like to read them from the bottom up. Personally, I like to go from the bottom up. So I would do 4, 3, 2, and 1. And the reason for this is because sometimes you may see an answer that you think it's right, and you jump right into it, and you click it, and then you just move on. And you're going to have a lot of options like this where they give you something that looks very good, something that could be absolutely right, for what they're asking you, but that's not going to be the right answer. So they want you to jump in that. So the reason why I go from the bottom up is because it kind of forces me to read all the questions. Like we said before, you need to read all the questions carefully. So I get to read all the options, and then I get to select the correct one. Okay. But again, you could do it either way. Just make sure that you read each and every question carefully. Some of the strategies to keep in mind, we talked about positive and negative event type of questions. In a positive event, you need to know that they are asking you to select the correct option. If it's a negative event query, they're asking you to select the incorrect option. If there is a need for teaching, they might ask you that the client said something wrong, all right, and that's why we need further teaching. So they're asking you to select the incorrect option. Okay, keep that in mind, very important. What you see here to your right is going to be the Maslow's hierarchy of needs. So for questions that require prioritizing, Maslow's is very useful. Okay, also your ABCs, if they're talking about, a client that's not stable, is not, dynamically stable, if that client needs or is having, hypotension, probably the client is having trouble breathing, they want to know if you are aware that the ABCs are there and how to use them, right? Airway takes precedence, breathing, and then circulation. All right, so prioritizing questions, you can use your ABCs, you can use Maslow's, and you can use the clinical judgment measurement cognitive skills, okay? Remember, sometimes all the options may be correct, but you need to determine the correct order of action, okay? So this is why using these tools will make answering these questions a lot easier, all right? Again, I have to mention the nursing process, again, is a systematic approach to patient care. I'm pretty sure you guys all know this, but the nursing process has 5 steps. Number 1, assessment. Number 2, diagnosis. Number 3, planning. Number 4, implementation. And number 5, evaluation. All right. So these steps are used by nurses to provide individualized care to patients. Again, I have seen questions where they ask you specifically this. They might ask you why we use the nursing process, and we use it to provide individualized care and improve health outcome. If they give you that, excellent. Now you already know what we use it for. Sometimes they want to know if you know which step of the nursing process the client in the question is, or if you know what steps come next, right? So you need to keep aware of what these are. We're going to go over each and every step in another video, but I just want I wanted you to be aware that the nursing process is there, that you can use it, and it has 5 steps. Again, also you can use a clinical judgment measurement model. These are 6 cognitive skills. Number 1, recognizing cues, analyzing those cues, prioritizing hypotheses, and generating solutions. taking action. Number 5, and evaluation of the outcomes. Okay, this is also another model that you can use to answer these questions. Okay, pharmacology strategies. I cannot go without mentioning these. Some pharmacology tips, I would say, that you need to keep in mind for pharmacology questions. These are kind of a general rule. I have seen a lot of questions that come up and they ask you directly to see if you are aware of these things. Number 1, antacids can affect medication absorption. Specifically, when we talk about antibiotics like levofloxacin specifically, right? If you are taking antacids, then you might have a problem absorbing those antibiotics, and whatever infection you are trying to cure is not going to be cured and probably just get worse, right? So they want you to know that if you are aware of this interaction and how to avoid it, right? And again, it has to be directed by a healthcare provider. If the person is going to be taking them together, it has to be coordinated by the doctor. All right. Enteric coated sustained release tablets and capsules should not be crushed or opened. All right, should not be crushed or opened. So whenever you see a question that tells you, hey, maybe you can split it in two, no. All right, that's probably not going to be the correct answer. All right. Number 3, clients should never adjust medication dosage or abruptly stop taking a medication without their provider's approval. All right. Patients should not adjust the medication or stop taking them. All right. They cannot change the dosage on that medication. Only the doctor can do that. Number 4, the nurses should never adjust medications or discontinue medications without the approval from the doctor. So the client cannot do it, but you as a nurse, you cannot do it either. You cannot change dosage on a medication, or you cannot discontinue the medication. It has to be done by the doctors. Number 5, the client should not take over-the-counter medications or herbal preparations without healthcare provider approval. Again, the doctor has to do that. You're probably going to see when we talk about pharmacology, you'll see medications like St. John's wort and things like that. You know, these are over-the-counter medications and herbal pills that you can buy, and sometimes they have interaction with other medications. So you need to be careful. The doctor needs to be aware of everything the client is taking, because we are trying to avoid possible unwanted pharmacology interactions. Don't go away. Let me go back here because we have 2 more to talk about. So the client should avoid consuming alcohol while taking a medication. Okay. Don't drink alcohol with a medication. The reason for that is remember that alcohol is actually a inhibitor of the cytochrome P450 system in the liver, right? And if you inhibit that, then those medications that you're taking might not be, they're not going to be metabolized the way they should be. So, you know, you might end up having the medication longer in your system, and this could actually be harmful for the client. Number 7, medication should not be administered if the prescription is unclear or identifies a non-standard medication use. And I have seen this question come up over and over again. If you are not sure of what the prescription says, you should not administer this medication. Or if you think that there's an error here on the medication dosage or probably not the use for that medication, then you should definitely not administer the medication and contact your doctor. All right. Kind of a few tips. Again, I'll try to make a video on this. Kind of go into more detail, but just a quick strategies that you need to that you could keep in mind when we talk about some strategies for the test. So now we're going to go over some our main theme for today, which is the population health, part of the professional standards in nursing. There are a few things we're going to go over here, and probably we're not going to get to do the whole thing today, so I might do another live because I don't want this video to be too long. All right. But as a nurse, I want you to be aware of a few things for the NCLEX examination. Number one, healthcare disparities. Okay, what is that, and why is that important for the test? Again, the reason why I wanted to do this is because I have seen a lot of students fail the NCLEX because they're not aware that this actually comes up on your exam. And in the last couple of years, it's actually been showing up a lot more on the exam. And people usually they're not exposed to this information, so they tend to miss out on these easy points. Again, these are easy points that you should not be missing on the exam. So if you're exposed to this information at least once or twice, you should be able to answer all the questions without a problem. Okay. Healthcare disparities, right? What that is and why it's important. Okay. Pretty much it means the differences in healthcare that are offered to different groups of people. Okay. And the reason why this is important is because we more than likely are talking about vulnerable groups, and they are at risk for health issues, right? Mainly because they have less access to healthcare. And we're talking about minority groups, people who don't have insurance, right? That kind of makes sense. People who live in poverty or homelessness, people with chronic health problems or disabilities, immigrants, refugees, people who have limited English proficiency. That kind of makes sense too, right? Those who are incarcerated, and members of the LGBTQIA community. Okay, so these people, usually for this population, it's important that you recognize that there's going to be a difference in healthcare and the healthcare that's provided to this population. So, and the reason why this is important is because vulnerable groups experience greater risk factors. All right, they usually, like I said before, they lack necessary access to care, and have increased morbidity and mortality, meaning they get sick a lot often and they die also more frequently. Okay, when we compare them to the general population. So as a nurse, you need to be aware of healthcare disparities, and you need to plan, and you need to provide adequate healthcare to this vulnerable population who is at risk. That's why they test you on the exam about this. All right, they want to make sure that you're aware of this, and they want to make sure that you know how to provide care to this population. Okay. So things you need to be aware of is chronic health problems and infectious diseases in the United States for this population. Also, what the risk factors are, how to screen for these health problems, for these infections as well, and determine what the protective measures and support services we have available to this population in increased risk. Okay, so plan appropriate education strategies and connect clients or families with the identified support services. Remember, you are going to be an advocate for your clients, so you need to be aware of where those resources are and how to get them, right? What are minorities? Minority groups, and why do we need to be aware of them? Well, number one, they're going to show up on your exam, probably a lot. Okay, but if they do, it's a good thing because it's easy to understand why you're being tested. These are not things, that require deep knowledge of physiology or pharmacology and whatnot. As long as you're exposed to the information, again, you should be able to uh, get to the answer without a problem. All right. So they want you to know that minorities, they lack healthcare coverage, especially that they lack health insurance. All right. They usually don't have a regular doctor, probably because they can't afford it. Right. So that kind of makes sense. They want you to be aware of the Hispanic population, the Latin population, all right? And they want you to know specific things about each population. For Hispanics, you need to know that they have a higher rate of obesity, diabetes, all right? End-stage renal disease, all right? Probably secondary to diabetes is the most common cause. And also cervical cancer in women of Hispanic descent. And the reason for this is because usually women in this population, they don't get screened regularly for HPV virus and things like that. So you're going to see a higher incidence of cervical cancer in this population. All right. And since diabetes is going to be a big problem in this population, remember, when you have diabetes that's not controlled for a long time, then you get end-stage renal disease secondary to that diabetes. So this can also be a problem. All right. Number two, Native Hawaiians and other Pacific Islanders, right? Things you need to know about this population specific that shows up on your exam is that they have higher rates of smoking, all right? And again, this could lead to pulmonary cancer. So you have alcohol consumption is an issue in this population, obesity, diabetes as well, hepatitis B, HIV, and tuberculosis, all right? One of the things that I have seen show up on the exams a lot is the high infant mortality in this population. You're probably going to be asked about this. They do have a higher incidence of infant mortality and sudden infant death syndrome. So they want you to be aware of that. You're probably going to be tested on that. So if they ask you which population has a higher infant mortality rate, and definitely think about people in Hawaii and people in one of the Pacific Islands. Again, they don't have access to care because they're isolated. Probably that could be an issue. So regular screening for women who become pregnant might be an issue, right? Because even though they have clinics and hospital, it's a cultural thing, right? They're not going to have those regular checkups, so that could be an issue. Native Americans and people in Alaska, all right, they also they face some challenges when it comes to healthcare, probably due to where they're located, right? Again, another population that's going to be isolated. Income is going to be an issue here, all right? So the socioeconomic card comes into play here. But you're also going to have things like smoking, alcohol use, diabetes, cancer, stroke, heart disease. Mental health is going to be a big issue. So I've seen questions on mental health in this population, so make sure you keep that in mind. Suicide, infant mortality, also an issue here. Sudden infant death syndrome as well. So now you have seen two populations that have this same issue, right? Teen pregnancy, also an issue. Liver disease, probably secondary to the alcohol consumption, right? And hepatitis is also an issue here. Wait, don't go. Two more populations of interest is here. It's African Americans. So they're going to have a high rates of obesity. You're going to have diabetes, of course, it's an issue. Hypertension, very important. Probably one of the things they ask the most about African American is hypertension. Remember, people of African descent or darker complexion of the skin, they tend to retain sodium, all right? So remember, whenever sodium goes, water follows. So If you retain sodium, then you're more propensive to have higher pressures of the blood pressures, right? So it's going to be higher. This is the reason why they tend to have hypertension more than any other population. Also, there's going to be a diet issue here. It has to do a lot with what they eat. Like with any other culture, it's going to be influenced by the culture as well. Asthma is a problem here, and cancer, right? But the leading causes of death in African Americans that you're going to be tested about is heart disease, probably secondary to the hypertension, cancer, and stroke. All right. Asian Americans have a higher rates of cancer. Probably what you're going to be tested on is cancer in this population. But they also have tuberculosis, hepatitis, but the leading cause of death is cancer. And there's a reason why we have cancer as the leading cause of death for Asian Americans, and it's in their diet, right? Their diet, they eat a lot of smoked meat, smoked products. So this actually leads to higher incidence of gastric cancer, right? Because of what they eat. All right. So very important to keep that in mind. I have seen a lot of questions that come up about this population, and they want you to know, or they want to see if you know that, cancer, specifically gastric cancer, is an issue. And the reason for that is smoked meats. All right. Right. Let's continue here. What are they expecting you to know about, how to provide care for this population? Again, you need to provide culturally responsive care. That's the reason why we went over all those differences between these populations. This is going to be essential for a better health outcome, okay? As a healthcare professional, you must be aware of these variations and the risk factors as well in order for you to provide better healthcare to these populations. So you need to examine their values and be aware of each and every one of these groups' needs, okay? Whenever they're asking you about the language barrier, make sure the answer is always going to go, or it's always going to be a designated interpreter, all right? And the reason why we want to do that is we are trying to keep confidentiality and accuracy, all right? Number 5, lack of preventive care in these populations can delay, right, the health care for these groups. So usually, since they don't have preventive care, they tend to get sick more often than any other population. Again, as a nurse, you need to know that education, exercise, and prevention of disease is crucial for these groups, because it's going to be a lot cheaper for us to prevent a disease than to treat it, right? So that's what we're aiming for. Teach back method. I've seen many questions about this. They want you to see if you know what the teach back method is, right? And pretty much whenever you are providing information to a client, make sure that you use the teach back method to ensure safety and understanding in healthcare situations, right? Pretty much you are going to tell the client to teach what you just told them, teach them back to you, all right? This is what we call a teach back method. See if they understand what you are telling them. Community of interest is the LGBTQIA community. It's diverse, a lot of individuals in this community. We as healthcare professionals need to understand and address their unique healthcare needs. Remember, in this population, a fear of stigma and discrimination can prevent accessing necessary care, all right? So you need to be aware of this. Transgender individuals may be less likely to have certain screenings completed and they're also less likely to come in and screen for sexually transmitted infections, right? So, whenever you have a chance to educate about this, make sure that you do it. Breast, cervical cancer, depression, suicide, and rejection is going to be the main concerns in these populations. Okay, so having a strong support group is very important for this specific population. All right. Also, rejection, victimization, bullying, right, can lead to being absent from school, right, and mental health issues. So we need to make sure that this is an issue, and we need to be aware of that so that we can provide the appropriate measures. Same-sex couples, they may face barriers when it comes to childbearing, right? So adoption is an option, right? And artificial insemination and surrogacy, right? So these are all options that we need to be aware that we can provide to this population, all right? Homeless people. All right, excellent. Let's see here. Homelessness. This can actually offend all backgrounds and families. You don't need to be of a specific race or background to be affected by homelessness. This can actually happen to anybody, and not one person, but can happen to families as well, right? In this population, we're going to have a risk of early death and common health problems, right? Disability is going to be a barrier to get a job, all right, which can further the homelessness, right? It could make it worse because you cannot get a job, you have no money. Makes sense that you might not be able to afford a home. Homeless infants are at risk for low birth weight and a high infant mortality. That makes sense. Homeless children are at risk for various illnesses and mental health issues. And usually they have, when they have this unmet basic needs, they tend to grow up with behavioral problems and attention problems in school. So, if they're facing these challenges early in their life, it might affect them when they move on to a school or places where they need to behave a certain way. Youth, if it's younger people that are being affected by homelessness, teenagers, right? They're going to be at risk for risky behavior. This is important because I've seen questions that come up about this: risky behavior, substance abuse, mental health issues, abuse, and STIs. So you're probably going to be tested about this. So make sure that you're aware that these are risk factors for this specific population, okay? And we're going to leave it here for today. I want to We're going to leave it here for today, and probably going to do another live session probably sometime this week. Make sure that you check on the channel whenever we are going to do that. If not, probably Monday at the same time. We're going to go over some other things that you need to be aware of, and we're probably going to go over as well a few questions. All right. So again, thank you for being here, and I'll see you guys on the next stream. Have a good night.